All right, this is Dr. Drew Hall again here from Los Angeles, Upper Cervical Health Care. Today what I want to talk about are two little bones at the base of your skull. The first one where your head rests is called atlas, and then the second one is called axis, and it's called axis because of that projection you see right there. The atlas fits on axis, and the little dens, they call it, fits right up through the atlas. And C1, 50% of left and right head rotation happens around that axis. That's why it's called axis. Now, the C1 and C2 are the only two vertebrae in the spine that don't have a disc that fit in between them. So between the head, right here, your head resting on C1, and there's no disc there, and there's also no disc between C1 and 2. So the C1, 2 and the head junction, that's where the majority of the range of motion in your neck happens. And because of this, it predisposes it to being weak. So the work that we do in our office, we're concerned with how do these two bones, how are they fitting joint-wise, and are they out of position, and are they locked, and are they impacting the central nervous system? Your spinal cord runs right through there, right? So why is this area special? This area is special for several reasons. Number one, anatomically speaking, you have the head that rests on C1. The head weighs 10 to 12 pounds. C1 weighs 2 ounces. So basically your whole life, you're carrying around a bowling ball and it rests on two little joints right here. It's held together by ligaments, soft tissue, and muscles, right? So structurally speaking, the C1 head junction is the weakest biomechanical area in your spine. To make matters worse, it's neurologically most important. So the brainstem passes right down through there, and I want you to think of the brainstem as the pentium chip of the body. When you go to work, you're using the brain that's in your cranium. When you're in your backyard and you're daydreaming about the trip that you want to be on, you're using your brain inside your head. When you go to sleep at night, and your heart keeps beating, your blood pressure is maintained, and your immune system keeps functioning, and your blood pH stays in a very tight range, and your blood pressure becomes regular at a certain range, and your body maintains 98.6 on thermoregulation. All of those things that you don't think about are all controlled in the brainstem. So you have structurally and anatomically the weakest link in the neck, and it houses the most important neurological area of your whole body, your brainstem. So why does that matter? Well, it matters when it comes to your health. Lots of people have trauma through life. It's very rare that you can find someone these days that hasn't been in a whiplash injury or a sports injury or fell off of a cheerleading pyramid or had a slip and fall in their bathtub and smacked their head on the bathtub. There's lots of things that happen through life. The average kid that learns to walk falls down 2,500 times. So through the course of our life, we have blunt head traumas that can cause C1, where it fits to the head, to dislodge and lock under the skull. Why does that matter? Well, I just told you. Your brainstem passes right down through. That's what controls and modulates most function in your body. And if you have a structural misalignment at the base of the skull and there's an irritation to the cord, you're not going to be as good as you can be. So upper cervical doctors are trained specialists in determining exactly, number one, do you have a misalignment at the base of the skull? Number two, if you have it, what direction is it off? Is it gone back into the right, to the left, back to the right, forward to the left? Everybody's different. Everybody's out of place different. Everyone's joints are built differently. And so, once we determine exactly, number one, that you have a problem, and number two, how you're out of position, a very precise correction is made to get the vertebra back under the body's control. Once the vertebra is back where it should be, and is back under the body's control, the soft tissue can then go through a healing and repair process. The spinal cord, which was impacted, which was tractioned, which was interfered with, which causes your neurological system not to work as well as it should, starts to function better. Tissue at the other end of the interference to the central nervous system that was affected, low back muscles that are tight, shoulder muscles that were tight, your GI tract that wasn't working right and causing you to be nauseous or constipated, whatever it may be, starts to return back towards normal function. So your upper cervical spine is very important, not only biomechanically to your function, but neurologically to your health. And many people in the public who have chronic health problems have absolutely no idea that the things that they've been living with for 10 and 20 years that they've been told are all in their head, or they'll have to take this medication for the rest of their life, are simply just this vertebra that's locked out of position, impacting the nervous system. So upper cervical chiropractic is not a cure-all for everything, but having been in practice for 16 years and seen over 8,500 patients, I can tell you one thing. If your atlas is not where it should be, you are not going to be as good as you could be. And many times, many of the chronic problems that people have are all related back to this, and when they get it fixed, the body heals and recovers from it. So if you're in the Los Angeles area, we'd love to offer you a free consultation in our office. That's just an introductory testing and explanation, which I already gave you, and going over your case history to find out what you're dealing with. If you're outside of the Los Angeles area, you can go to blairchiropractic.com or upcspine.com to locate an upper cervical chiropractor in your area. I hope this information's been helpful and it reaches some people that really need it.